Micronutrient tests, a very important diagnostic tool for the assessment of your nutritional status. We will start by discussing what micronutrients are, their function, what happens when you're deficient, blood tests, and the importance of knowing micronutrient levels for the optimal functioning of your body. Just before we get started, a quick disclaimer. This video is for educational purposes only, and you should consult your healthcare provider for your specific needs, questions, and concerns. Micronutrients are organic and inorganic elements needed by your body in relatively smaller amounts. They consist of vitamins, minerals, trace elements, various biomarkers, metabolites, fatty acids, amino acids, antioxidants, etc. For the purposes of micronutrient testing, the most important parameters are your vitamins, minerals, and trace elements, although many labs also measure various other biomarkers. As you can see over here, we have our lipid-soluble vitamins, water-soluble vitamins, certain macrominerals, for example, sodium, chloride, potassium, sulfur, and other trace elements as well, for example, iron, iodine, manganese, selenium, zinc, etc. These are essential for the optimal functioning of various metabolic processes, hormone regulation, protein synthesis, cellular repair, gene expression, immunity, reducing inflammation, etc. Extracellular versus intracellular micronutrients. Yes, there is a difference between the two. The extracellular nutrients travel freely within your blood plasma, and their concentration is directly related to your dietary intake and intestinal absorption of your food. This represents the bioavailability of micronutrients for cellular intake, which is where the metabolic processes occur. The extracellular micronutrients do not take into account what the cells inside are receiving. The intracellular micronutrients are present inside the cell where metabolic processes occur. These processes include detoxification, protein synthesis, breakdown, energy production, gene expression, cellular repair, etc. So the intracellular concentrations indicate the cell's ability to uptake and utilize the available micronutrients. This is a representation of cellular functionality. In other words, how the cell is using the micronutrients which are available in the blood. So what happens when you have deficiencies in the micronutrient levels? Even though micronutrients are needed in smaller amounts, their deficiency can lead to many systemic issues which often can be severe, even life-threatening. According to WHO, the most common deficiencies in micronutrients around the world are of iron, vitamin A, and iodine. This is especially amongst children and pregnant women in low-income countries. Deficiencies in essential vitamins, minerals, and other trace elements can manifest in various ways, such as pain, fatigue, weakness, accelerated aging, hormone imbalances, free radical damage, low immunity, cell dysfunction in metabolism and repair mechanisms, alterations in gene expression, and various others. The specific vitamins, minerals, and their deficiencies can be discussed in another video, but this is a brief overview of what micronutrient deficiencies can look like and manifest as. Micronutrient testing is a safe and effective way to measure both the extracellular bioavailability as well as how effectively cells are utilizing and uptaking these available micronutrients. It helps to establish and monitor body's baseline levels and identify functional deficiencies. Blood samples are taken and sent to a lab where various micronutrients, vitamins, minerals, trace elements, amino acids, fatty acids, biomarkers, etc. are measured. They're measured at the extracellular level, which is found in your blood plasma, as well as the intracellular level, which is found inside of your white blood cells and red blood cells. A urine sample may also be taken to measure certain metabolites and waste products as an indication of cellular functionality. A routine blood test measures serum concentrations of micronutrients. This reflects the extracellular reserve that is bioavailable for your cells to absorb and utilize from blood. However, it does not accurately represent intracellular absorption and utilization. Various metabolic processes such as detoxification, protein synthesis, breakdown of products, energy production, gene expression, cellular repair, etc. occur inside the cell. Therefore, merely knowing blood concentrations of micronutrients from a routine blood test is not an accurate representation of the functionality of your cells. Although one can have sufficient amounts of micronutrients from diet, they can still be deficient in the intracellular amounts. This can be due to various factors, for example, poor transport across the cell membrane, malabsorption, missing cofactors or enzymes, or the dysregulation of proteins. Therefore, the benefits of micronutrient testing can be very important in the understanding of how extracellularly bioavailable nutrients are accessed at the cellular level. This is an important indicator of the functionality of your cells. It's an effective tool in establishing one's baseline levels to then help in optimizing health goals, nutrition goals, and your fitness regime. Micronutrient testing can also be helpful in identifying the root causes of various abnormal symptoms such as fatigue, weakness, pain, etc., which result from micronutrient deficiency. This is also a good indicator of one's cellular function, age, and metabolic abilities. And with that, I'd like to thank you for your attention. If you found this information useful, please like, share, and subscribe, and comment down below your feedback. For your specific needs and concerns, please consult your healthcare provider for more information on micronutrient testing.